Well, each year, the cost of prescriptions continues to increase, with NBC reporting the average price hike is around 4% annually. For some people, that may lead to sticker shock at the register. NBC Connecticut City Boyle is live in Wolcott, where she spoke to a local pharmacy about how maybe people can save.
Kevin, here in Wolcott, there's only one pharmacy, and that store owner has said that people are seeing a little bit of shock value at the register. Now, we've heard a lot about healthcare premiums rising this year, but experts say you should also keep an eye on the cost of your prescription.
So, like people that we saw copay with no copays last January, this January they have copays. And they're not happy about it.
As people pick up their prescriptions for the first time this year, they may notice some changes at the counter.
So as with everything else in healthcare, it seems prescription drug costs tend to be rising overall.
This year, we had anticipated about a 4% increase in drug costs based on a number of resources.
A number of reasons are contributing to this, including healthcare plan changes, with some experiencing higher out-of-pocket caps and deductibles.
And a lot of people, they don't understand insurance until they come to the counter.
Prescription benefit managers. So the PBMs are the ones who really control and set that price when you go to the counter.
Technological advancements also mean new life-changing drugs are oftentimes only available as brand names.
Many people know generics are cheaper. And so with the advent of new medications, new technology, there's certainly an impact to cost.
Wolcott Pharmacy says drugs such as Ozempic actually cost more than what they were expecting.
What's out there is not matching up with what we've seen. We would obviously assume that we're going to buy it for less. But no, instead we're paying over $200 more just to bring it into the store.
Through the Inflation Reduction Act, the government has negotiated down the cost of 10 prescription drugs for Medicare holders, but 350 drugs are set to increase.
Almost every year, manufacturer pricing goes up a little bit at least.
So what are the best ways for people to save at the register?
You can look at cards like GoodRx. In Connecticut, we have ArrayRx.
Our model is we'll buy the drug, whatever we pay, we'll stick on $15 for our overheads.
Experts also recommend calling ahead of time. That way you know how much you cost and how much you need to bring with you. They also recommend knowing what your plan covers and what it does not cover as well. Live in Wolcott, City Boyo, NBC Connecticut News. Kevin.